Hi, I'm Angela Gambrel, author of Surviving It, the Eating Disorders blog for healthyplace.com. And tonight I would like to talk about a common misconception about eating disorders, and that is that eating disorders are only about being thin. And the reason this is on my mind is that two reasons actually. One, that I've been watching some YouTube videos of a well-known talk show, and I won't name the talk show because that's not really relevant. And the shows themselves are fine. It's helpful to hear from different people about, what has worked with them in eating disorder recovery, the things that they've struggled with, what hasn't worked, and that kind of thing. But it's the name of the shows that I really object to. And one show was called Deadly Thin, and the other one was called Scary Skinny. The second reason I am thinking about this is that, as many of you might know, this has been National Eating Disorders Awareness Week, and I was at an event at my area hospital giving a speech, and one person in the audience mentioned that we had failed to address binge eating disorder. And that is true. We didn't overlook it on purpose, but on the other hand, binge eating disorder is one of those disorders that often gets shoved under the table because people are too busy focusing on anorexia or bulimia. Those are the more well-known eating disorders. But the truth is, binge eating disorder devastates millions of people, and it will be recognized as a disorder in the DSM-5. And therefore, it would be important for those of us within the eating disorder recovery community to learn more about it. Now, back to the television shows. The fact that they call it Deadly Thin and Scary Skinny overlooks a large portion of people within the eating disorders community, and that is people who have bulimia, are often either at a normal weight or sometimes can be overweight, people with binge eating disorder who often can be overweight, and people with eating disorders not otherwise specified who don't meet the clinical criteria for anorexia or bulimia, but still struggle with what is called disordered eating. And my point is that eating disorders are not just about being thin. In fact, even if someone is super thin because of their eating disorder, the thinness is a symptom. It's not the goal. It may seem like that because many people say with anorexia might say, well, I want to be thin, and they focus on calories and they focus on obsession about weight. But in reality, in my opinion anyway, most eating disorders are about control and being able to control your emotions and not have to face those troublesome emotions because of whatever happens. I'm not going to speculate what causes eating disorders because we don't know that at this point. But the thinness that you see with anorexia or the purging of food or the excessive eating of food with binge eating disorder are symptoms of a more serious underlying problem or problems, and that is dealing with emotions, feeling out of control and feeling you have to control something so you can control your weight, you can control your body, you can control what you eat in one way or another. And as we all know, weight restoration or weight stabilization, or in the case of binge eating, losing weight and reaching, in whatever spectrum of eating disorder you are, reaching your healthy goal weight is only the first step in recovery. If you don't address the underlying issues of what fueled, pardon the pun, the eating disorder, then you are not going to have a very stable recovery. And that's why I object to shows that call it Deadly Thin or Scary Skinny, because it puts the focus on weight, and especially some of these shows oftentimes throw out numbers. This person weighed this person weighed that, this person ate this many calories, this person ate that many calories. And the whole focus is on weight and numbers and everything, which is part of the obsession with eating disorders. And it's not about the underlying causes and the pain that a person with an eating disorder feels and that manifests itself with the eating disorder. I always say, my struggles with anorexia are an outward symptom of my inner pain. It shows the things I have trouble dealing with, and that's the way I, for whatever reason, and I'm still not sure why, I chose to deal with them by developing anorexia. But I didn't choose to be thin. If I just wanted to be thin, if I wanted to look nice, I definitely wouldn't have gotten sick with anorexia because, one, I didn't look great. I looked awful. I looked like I was dying. And I wasn't happy whether I was at my lowest weight or whether I was at a stable weight but still struggling with eating disorder thoughts. I was not happy at all. And therefore, the weight issue was just a symptom, not what drove me into my eating disorder. And there's a lot of different underlying things that me and my therapist are still learning about. And I'm sure that you and your therapist, those of you who are listening, are working on also. So I just like to leave you with, the fact that, the misconception is that eating disorders are about being thin, and that's just simply not true. And it excludes a lot of people who are struggling with eating disorders. So I hope this information's been helpful, and please look at my blog, Surviving Ed. I will be writing this weekend about National Eating Disorders Awareness Week 2012 and the things I've learned and what recovery means to me. Thank you.